Good day. I'm Vince Salas, part of the Filipino Fiesta Organizing Committee, and today we're conducting an interview with Filipino Community American leaders who are tackling COVID-19 at the front lines of this pandemic. Filipino Fiesta, if you're aware, is scheduled to happen on June 5th, Sunday this year, and well over 74,000 Filipino Americans converge at the Jose Rizal Community Center to celebrate our culture and all of our achievements for the year. Many of our community members work in healthcare, and one of the issues that we're going to talk about today is healthcare, health advocacy, and health equity, specifically in response to our community's handling of COVID-19. So today we have three leaders who will have a discussion with us: Bobby Guling-Roy, Megan Sapigao, and Murray Navarro. Welcome, everyone. So let me just start off with just checking in with you. It's been a tough couple of years, and now we're adjusting, it seems, to post-quarantine life and less stringent mask mandates. How are you holding up? Let's start with Bobby.
Thank you, Vince, and thank you everyone for having us here. It has been a seemingly long 2 years. I am actually feeling very optimistic, though. I know that we continue to head in the right direction, but I will feel a lot better when our youngest, ages 6 months to 4 years of age, will be vaccinated, because right now they're probably the most vulnerable in our community.
Thank you, Bobby.
Yeah, I'll take it from here too. I totally echo Bobby's sentiment on just being optimistic, but and really getting a chance to kind of reflect on the last 2 years and how our communities responded. It is a really hopeful and proud feeling how far we've come and how we've taken care of each other, but also cautious to making sure that we, enjoy our community gatherings and family and recover, but continue to stay protected and vigilant, because it's not over.
Thanks, Vince, for having us. I'm so thankful for this endemic of this COVID-19, because we are, even though we are now in a less stringent kind of precautionary measure, we still need to be, we still note that we still have that kind of thing around us, that's invisible enemy that we are having right now. And even though CDC already okayed us with a little bit leeway to work out all those things, I think as a teacher, I need still to wear those masks inside the classroom. And also in every community event, I still need to be cautious about these things, because we're not yet totally uncouth with this virus.
Thank you. And it's great to hear your sense of optimism, but still be cautious, right? Because as you all said, it's not over yet. There's still segments of our community that are still unvaccinated or may need more information. Right, so let's do formal introductions. Share with us the roles that you play in the community with regards to COVID-19.
I'm Murray Navarro. I am the current president of this event, and I am also involved as COVID community health worker. I was trained by ARI during that time wherein it was drastic for us to dive into this event, into this pandemic. So I got in, and at this point, I'm actively working as a community health worker.
Right, so Murray is actually the president of Filipino Fiesta this year, working with the organizing committee.
I'm Megan Sapigao, and I'm the co-executive director of the Asian American Liberation Network, which was an organization founded at the start of COVID, in response to COVID. And, I think my role, even up to this point, as we continue to do work in our communities around COVID, it's really been to just ensure that community members in Sacramento region have access to, whether it's PPE, life-saving vaccines, testing, or therapies that will allow our communities to thrive and continue to survive this pandemic as we move forward. I think too, our role, the Asian American Liberation Network with the Filipino communities, as many other Asian American communities, is, when we talk about access, that includes, the ability to navigate digital mechanisms to access, vaccines or testing or appointments. That includes language access, right? That includes, testing sites or access sites that are in our neighborhoods. So there's a lot around that, but that's our role.
Yeah, my role has changed a lot since the beginning of the pandemic. Initially, I first got involved because, as the treasurer of the Philippine National Day Association, we sought out ways to help out our community members that were losing part of their income. Maybe they had lost hours, they were laid off, and so we advocated with the city, were able to get a grant, and we started to give micro grants to community members. But then what we also saw, as our community members, a lot are in the healthcare field, right? We're 1 in 4 nurses in California. We also saw that they were being impacted health-wise. My zip code, I live in the 95823 zip code, right along that Mac Road corridor where Seafood City is and many of our businesses are, and many of our community members live. We've always had the most COVID-19 positive cases, hospitalizations, and deaths the entire pandemic. And that's my neighborhood. These are my neighbors, and these are my friends and family. 2 of my aunts passed away from COVID-19. So it didn't make sense to me why testing was not happening in our neighborhood and in our zip code. And so we had to advocate for that, and we got community testing. So that's been my largest role as I sort of got promoted up the ranks, and I started to really lead and coordinate 13 community test sites throughout Sacramento County, where we've tested over 300,000 people. And when vaccines became available, helping out with the vaccine effort. So just really a whole and comprehensive response to COVID-19 from the health side, but also the outside needs for our community members as well.
Thank you, all three. I mean, you really touched on how you all started in addressing COVID-19 in our community and the roles that you played. And you started talking about how was COVID impacting our community, right? So let's take a step back to early pandemic days. When did you start hearing about COVID, and what was it like for you?
Yes, stepping back 2 years ago, I was at the college wherein I teach at nighttime, and all of a sudden we heard that shelter in place from the governor, and we have to stop right away without our training. We have to change our lives, getting all those materials outside the classroom and stay back at home and work it online. Imagine a professor or a teacher who'd never been in an online class, wherein you have to teach right there and then instantly just to cater or continue the process of teaching. So there is a really great impact wherein this COVID-19 changed our lives, not only as a community leader, but any walk of life, like a teacher myself, wherein I have to teach every student through an online case. I think the COVID-19 is now changing our lives at this point. Megan, can you butt into this one?
Absolutely. I think I agree, Murray, 100%. I mean, thinking it's a little cathartic to be able to talk about this now because that we're coming out of it, but it was terrifying, right? Because as I think all three of us, being in the community prior to the pandemic hitting, I mean, we understood inequity, right? For communities of color, particularly underserved communities. And so I remember, when we were hearing about kind of like what was happening overseas in the Philippines, and things like that, and wondering if it was going to make its way to the mainland. And thinking about, just pondering what it could possibly do to communities like ours who were already suffering issues with language, underinsured, like healthcare, wondering what it would do to, families who were undocumented, Filipinos are probably number 2 in California in terms of undocumented APIs, right? And so, I mean, for someone like me, I know, Bobby and I talked about this early on, what is this going to do to our community if and when it hits? And that was terrifying, right? And then not even like, and then you start thinking about the impacts of just ensuring that, you know, our livelihoods, right? We have a lot of our community members work in the healthcare system. They're on the front lines, right? And so if this is, if we're seeing folks, you know, healthcare workers in foreign countries that are from head to toe in protective gear, and we don't quite know yet, you know, like the virality of this virus. And I mean, it was scary to think that our parents or our aunties or our, you know, our young folks who are, you know, in pre-med and going on the front lines and coming face to face with this virus. And we know Filipinos are right there, right? So there's just so many things that were just unknown, and we were terrified. And so I think too, you know, like Marie said, then there was just like the everyday impacts. I mean, the job that I was doing at the time, we were converting to virtual. We had community events planned, and I remember speaking. We had events planned at like community centers, and you know, when you talk about community events, you're talking about food, you're talking about like promotional things. Everything shut down. And so it really prompted us to think too about, you know, our workers, our labor force. What was this going to do? How are we going to get resources and information to each other? We're dealing with, you know, you started hearing about the digital divide, as Murray talked about, and what is that? It's one thing for someone who is technologically, who they would consider to be technologically, you know, sound. I know how to work my Apple computer or my iPad. But I started, you know, we all started thinking about, oh my gosh, what is this going to do to our elders who, you know, they don't know how to start a Zoom account. And now we have to make digital appointments and see our doctors digitally and all these new portals and apps. So it was a lot, you know, needless to say, it was a lot, and it was terrifying.
Yeah, that digital aspect also, not just our elders, it impacted our students, right? Like, you know, like I said, I'm from the 95823 zip code, but I attended Elk Grove Unified Schools. Elk Grove Unified was the first district to shut down in the state, right? And when that happened, I remember thinking to myself and talking with my colleagues and friends, because I also work at the State Department of Education, like, was this premature? Like, what's going on? In hindsight, and it's always 2020, right? Like, it was the right call. But if you can imagine new students during that first year of the pandemic, like a kindergartner spending all that time on Zoom, like, no, kindergartners need to interact and play, and, you know, like, they learn by experiencing. So it was very, very different during that time for our students as well. That sense of isolation was affecting everybody, causing more, you know, mental health needs. So in the county, right, being able to work with the Sacramento County Collaborative, we were able to get free mental health services out there through the county and anybody that could avail of that. But again, it had to be accessed via Zoom and these electronic methods that not everyone was necessarily prepared for. But yeah, that impact, I remember really being worried about our students and our kids too, because just, you know, everything that we're learning about now, about all the learning setbacks and the summer regression, like these past 2 years has been a lot of that. And, you know, thank God our dedicated teachers and everything are still doing what they can to overcome that. But we have to be realistic with ourselves that learning hasn't been the same the last 2 years.
Yeah, and along with learning loss, right? And there are studies that indicate that students of color are actually further behind because of technology issues, digital divide issues, access to stable internet and computer issues. I just want to say to you, Bobby, my personal condolences. You said that you lost family members. I also lost friends, both here in the U.S. and in the Philippines. And it's interesting how this pandemic has really bridged that, you know, a lot of it through social media, right? You're finding out friends in far places, right? And really underscores the transnational nature of our communities and how Filipino diaspora is really, you know, throughout the world, right? Whether in the Philippines, the US, or in Europe. So let me ask you another question about our kababayan who are working in healthcare, or frontline essential workers. What observation can you share with us as you were working with our Filipino American community?
So my two aunts were both frontline caregivers for the elderly. And we know at the beginning, like our elderly community members were the most at risk. This virus particularly was very strong against their immune systems. I think the other thing too, going back to what Megan addressed, was that we have community members that work in this industry that are also undocumented and that they needed assistance as well. So we did what we could to try to give them, funding to help bridge some of these gaps that was taking place. But, we're so dedicated. We care so much about people. Many of them wouldn't walk away from their patients. They're willing to risk their life to take care of them, not just because it's an obligation, but because of our respect for one another's humanity. Because we know that we care about people, and that's within the ethos of the Filipino, right? That's what it means to be Filipino. That bayanihan spirit, to take care of one another, that's within our being. And I don't know how many times I had heard stories of that no matter what, they weren't going to leave them behind, and that they were going to stick it through even though they were risking for themselves and maybe a family member. They were going to do what they needed to do to take care of that person that they've developed a relationship with, that they love and trust because they've been around them, taking care of them, and actually taking care of one another.
That Filipino value of bayanihan, and also the share that kapwa tao, right? Kapwa, that shared identity with your countryman, your kababayan, is so strong. Indeed, we try to take care of each other, right? And our patients. If you're a nurse, a frontline worker like that, and I have family members who are nurses, right? And they would go in and take care of people.
Yes, that's the whole point, Vince, because as we know that we are feeders of all those hospitals. Mostly of those nurses are Filipinos. And the first thing that came to my mind in a personal point of view is that how do we approach this pandemic if someone we know from our neighborhood who's a nurse and they were the first one to be put down because of this virus? So it's so hard during that time we're in to think when you see in your Facebook or your social media accounts when one is gone because she's a nurse in New York, nurse in UK, or nurse in somewhere else in Italy. She's a Filipino, and that's the whole point. Because as Bobby stressed that we do what we can do to save people because that's a part of our culture. Mm-hmm. And as being a Filipino, we cannot say no even though our lives are at risk. So that's the problem before we're in. And personally, my daughter is taking up nursing, and what will happen to her if she will be one of those frontliners? So as a dad, for me, for the future, I think of someone else who's putting herself at risk. Mm-hmm. And what can I do as a person to help these people? Or in the community, if I know someone, especially a friend of mine died during the first strike of COVID because he got it from a nurse son and transferred to the dad, and the dad who was a weaker immune system, got down first. So that is something that struck us before, wherein we don't know what to do because of our culture that's added to that purpose that we're doing for our community or to our health services.
I mean, Filipino nurses are kind of ubiquitous around the world, and also here in Sacramento, so many of our healthcare systems, whether it's Kaiser, Sutter, Dignity, mm-hmm. you will see a Filipino face, right? A Filipino nurse. Go ahead.
The system is held up by Filipinos. Let's just be clear, right? And I often think about, I bring a different perspective, because I'm I'm like third generation, and I'm biracial Filipina, and I kind of straddle these, like, because I see how Filipinos in the healthcare system are viewed. Oh, those Filipinos are just so kind and such great caretakers, and then when the pandemic hits, it's like, I mean, if we can just be honest, I often ask myself, why don't they value us? Why don't people want to wear masks, get tested, get vaccinated? Why do they, why are we so great when we're caring for them after a hip surgery, or we're taking care of your baby because they came in with 103-degree temperature in the emergency room? But when we are begging you to look at the numbers as to why Filipino nurses are dying at at exponential the rate of other nurses to COVID, being exposed, like we said, they don't walk away, they don't give up on their patients, and I get so frustrated because the impacts too are just so nuanced, right? I mean, I was thinking early on, I would be terrified to go on social media because I didn't want to know if we lost another community member. We lost so many community members in the last 2 years. We, the network in partnership with my sister's house and FCSV hosted, a series of town halls where we talked to our elders about the impacts. We talked to our healthcare workers and mental health care workers about the impacts to our Filipino community. We talked to our youth. And it really painted this picture about just the rolling impacts of, if I could give an example, I live in a multi-generational household. I have a family member who is high risk because of health issues that impact us as a community, right? Like, diabetes mellitus and asthma, things like that we see in communities of color and even the Filipino community. And so it was terrifying to be in a multi-generational household and know that the risk of exposure and infection was that much greater, and then you couple that with people who are working in essential work, cashiers, people who still had to go to work. There were no safety nets. You couple that with folks who are, still teaching their kids at daycares or still going to, care homes and the hospital and clinics and things like that. I mean, and it was infuriating, quite frankly, to watch our community members suffer in ways that other communities didn't, and ask, what is there for us? Not only do we have to sift through that mess, but we also have to continue addressing the things that affected us even prior to that, fighting for, our undocumented folks, fighting for our, language access and language equity, trying to make sure that our folks have good health insurance, that there are social safety nets. This was before COVID, right? So I guess, to go back to your question, Vince, when I think about the community response, I'm so proud of how hard our community fought and continues to fight for each other. And we continue to show up even when we're in despair. And sometimes it's really hopeless, in those micro moments. But our foundation is really strong. And I think it is rooted in, like you said, kapwa tao, when it's rooted in this transnational spirit that we, generationally, we've built family and friends on and community on. Very proud of that.
I think the only thing that I can really add, and it was a realization that I had just last week. I was at an annual meeting for race and equity in Portland, and all the folks that were like putting together all these Herculean efforts to take care of one another and have community care. A lot of times we're told, or told to ask ourselves, what's in it for me? And I realized that all the people that are helping and doing all this stuff, they actually adjust that question. And it's really, what's in it for us? And, I know that in the Tagalog language, there's two words for us, right? One that is inclusive of everybody, and then one that excludes who we're talking to, right? So just us, but not you. But then there's that one that includes all of us. And there's that distinction there. And it's very important that when we're talking about us, we're using that inclusive us, that collective we, and that big we is how we survive. This is how we have gotten through the history of colonization and like the constant trying to push down our people. And I think there's also this realization that we don't do it alone. In the efforts to get the testing and the vaccines going, to be frank, we've had a lot of black doctors step up for us and being willing to like get vaccines to our community when nobody else was trying to get us vaccines. And even though that initial effort didn't necessarily work because we were, quite frankly, really smuggling them to our community, we were going to smuggle 50 doses to our community members that we felt were at like the most risk. And it got stopped by the powers that be. It was their willingness to put their neck on the line that even made that even possible, to even give us that hope. And I thank everyone that's willing to be in this fight with us, because we cannot do it alone, and the only way that we win is by doing it together.
And you mentioned earlier how PNDA started a mini grants program. What other community responses did you see? I know, Murray, the Filipino community started meal delivery programs, right? Without any funding. Can you talk a little bit about that?
Oh, during that park, we were thinking about our seniors who were not able to go out and get their groceries, who cannot drive, for themselves to go somewhere else. So we were able to think of something else to provide, because they are the vulnerable cohort of the with regards to this virus, COVID pandemic virus here. So Tita Josie was the one who initiated the idea of what can we do with our seniors in our community? How can we help them? So FCSB came up with an idea wherein we had to provide at least a meal delivery for them once a week in order for them. It's once a week. It's not something that you can survive for the rest of the month, for the rest of the year, but something that it will teach them, or that in order for them to realize that someone out there cares about them. So that's the purpose of that meal delivery every week, so that even though they are there being isolated by themselves, someone is thinking of them. I think that's the big issue in that project we're in. We don't have any initiative. And as we were able to plan of these things, at the very beginning of it, we have zero money for this. But we were able to put something into the account, or to our bank account, wherein we solicited something. Towards the end of this project, we were able to gather more than enough that we were able to provide us at least 2 months of those meal delivery for our seniors. And the big thing about this one is that people, as we said, it's our culture to help one another. And towards the end of this project, we still have money actually at this point, which we cannot spend. I don't know how we're going to spend for that. But at this point, the bayanihan thing issue there is something that popped up in that particular project. Okay.
Right. And you mentioned that it went on for a couple of months, right? And the fact that it only not fed people, but also broke the isolation for a lot of our elders who are homebound and not able to go out. Yes. Anything else that you'd like to add in terms of what you saw as initial response from our community?
I mean, I think that, I was part of the effort to, with PNDA and the network early on to raise funds for, just to be able to give money for gas and utilities and things like that to our community members. But, there was also a lot of I talked earlier about the anticipation of what's to come, how our county health officials were going to serve us. We knew that there was CARES dollars coming down the pipe, right? And how were those, knowing kind of historically how federal and state funding makes it to our communities most in need, it was like, wow, this is really one of those times where we need to be at the table. And so there was this is essentially how the network was started. It was a joint effort, a multicultural effort with, the Hmong community, the Filipino community, the Black community, breaking down those barriers and demanding that we be heard during these advocacy efforts. I mean, we sat in meetings with Sac County Public Health really early on when we were talking about where are the testing sites for in South Sacramento and in these the data's here, where are the testing sites, and you know, making sure that we had say in where those testing sites are so we can be reached. We were talking about anti-Asian hate and how that was impacting our community, and who, you know, and how are we keeping our community safe, right? Something that we, you know, I remember talking, we were trying to figure out how we can be a part of the conversation, essentially. And so I think that was really important. I remember, you know, when information was coming out digitally, the county, Sacramento County, was like, well, of all the Asian languages, we have, you know, Cantonese and Russian. That's it. There were no dollars for Tagalog, Hmong, Mien, you know, and it was really disheartening. And so the only people in the room that were like, what's up with this, were the Filipinos or the, you know, the Hmong folks. And had we not been there, it would have been business as usual. So just little things like that. You know, it was just really important, the community response. We had to just work twice as hard, twice as fast, right, to make sure we were represented, because we knew that money was being gathered, that test sites were mobilizing, that PPE was going fast, that eventually, God willing, there would be a vaccine. And so how are we going to get them to our community? Those types of things. Having to work and be proactive was really critical for our community, in addition to making sure that we were cared for in the immediate, making sure that we could pay our bills, that our kids were, you know, attending school, and just all the other things.
So you started talking about some of the barriers that you observed, including language access, right? So Bobby, can you continue that thread? You know, what other barriers did you observe, and how did we as a community overcome these barriers?
Yeah, I think one of the big things also was just when it came to a reality for our community is that we are seen as very successful, right? Like, oh, you know, we have people, exactly, model minority, like people, like I personally have a job that I could work from home, right? So I'm protected. But when we really analyze our community, we know that it's starkly different. Like, and we run the gamut of people that can't work from home. They are like exposed all the time, taking care of people. Going back there was one Filipino caregiver. She knew her patient had COVID. But if she didn't go to that home and take care of that patient, who would? Yeah, there was not going to be anyone else that was going to do it. No one from the registry was willing to go there. No one was being forced to go there, but that person needed care. And so this caregiver willingly went there and stayed there 24/7, didn't go back home because they knew they were going to catch it. They knew they were going to catch it, and they didn't want to bring it home to their loved ones back at home. So they willingly went through it. They willingly caught it. They powered through it, you know, and fortunately both of them got through. They both healed. They were able to survive. But it's those kind of stories that, like, we have to realize people are making sacrifices every day to take care of one another. I think the only way that we get through it is like courage and community. I mean, that's really the only answers that I have. And sometimes that community comes in the form of a fellow Filipino. It could be a loved one. Sometimes it comes in the form of one activist employee at the county that's willing to step up and fight for us and fight with us. Sometimes it's in the form of that person that's willing to, like, can you help train me on how to do Zoom? You know, and being able to talk to me. We didn't have many answers in the beginning. And in this society and in this culture where we want to fix things really fast, we didn't have all the resources to fix things. And so sometimes instead of fixing or doing, it really came down to being that support person, being that person that was willing to listen, being that person that was willing to sit with you and figure out like what was going on. And I think that that's really like what it was about, like being that person you can count on.
Yeah,
Was what we
speaking to
had to
that,
do.
we're in barriers. We're talking about barriers here during the start of this pandemic, and we are thinking about those seniors again, where they are not computer savvy, and meetings were on Zoom, as what you said, Bobby. That how can we help them? So it's good enough that we had a United Way who helped us during the time, Vince. You know, you wrote a grant for this one for our seniors, especially for our community, wherein we were able to train them at least for a day or two for them to catch up with this technology, that in order for them to be a part of, again, actively part of the community here. So with regards to that, I think we also consider that ourselves being jumping into that point wherein, hey, there's a COVID and it's so dangerous for us. But for us, people in the community, wherein we don't have any training, for me as a teacher, I don't have any health care providing services or techniques for my community. But at least for some of us, we jump into that particular level wherein to bring help. Just like I was thinking when during the 9/11, we're in those firefighters getting into that building, they know that there's a danger there, and they still went through that building. So it's just like us during the time we're in. We know that's a danger out there, invisible enemy, and then we still work it out because we want to help. I think the essence for us Filipinos is that, as what we said a while ago, no matter what, as long as the help is there, we are ready to be on the front line with regards of our selfless issues of who we are.
I mean, this pandemic has really called us to action in so many different ways. In the ways that this pandemic has really magnified, certain inequities, but it also has lifted up, folks who want to step in, who want to lead, who want to advocate for our community, right? So I really appreciate that point, Murray. And, now that we're in the second year of the pandemic, right? We started hearing about this in late 2019, early 2020. It's about 2 years now. What do you think has changed in terms of our community's response over the last 2 years? And what approaches have been effective, particularly around testing and vaccinations, as kind of like we emerge from post-quarantine life, and some of the masking mandates have begun to lift?
I think about when we think about barriers too, around the vaccines. I mean, Bobby touched on this really briefly. There was when the vaccine first came out, January 2020, it was released to elders. I think it was like 70, it might have been 80 and above first, and then 72 and above. And I remember, it's like the county would release a link, 100 vaccines, and they'd be gone in negative 5 seconds. And then whenever, and it was frustrating because we would go through, like we'd click on the link, right? Like California Department of Health or Sac County Public Health would release the link, and we'd click through it, and it'd be like 8 pages of like your insurance and your name and like your, just all this stuff that you had to give up. And then you get to the end and be like, sorry, there's no appointments. And it was frustrating for myself, and I know Bobby did it. I mean, we were trying to just see what was available, and then if we could get something, just book it for like our parents or for whoever. And after several weeks of that, Bobby, like Bobby said, I mean, we knew we had this clinic, Dr. Teta, who was already, shout out to Dr. Teta, incredible Black woman doctor who, like Bobby said, just was willing to put her neck on the line, bring testing into the neighborhoods, get language resources, do anything she could. But we knew, okay, we can bring vaccines into that clinic and just give us some vaccines, please, and let's connect our communities. And I just remember that day, Bobby talked about how we were essentially smuggling from another doctor who was doing everything they could out in the North area to vaccinate, Black and brown communities. Because at the time, it wasn't Black and brown communities who were accessing those links, even though, it was affluent, digitally competent, English-speaking folks who were able to get those vaccines. People had an in. And when we were essentially shut down by the system, and let's be clear, this was county. This was the state, who were saying, no, you're not going through the proper channels, you're not doing it correctly, who shut us down after we already booked, I think we had a few dozen, and we had them assigned to our oldest Filipinos, APIs, Black folks who were waiting to be vaccinated, who had been on the list for weeks now, but just couldn't even get in. And when they ripped the carpet out from underneath us, I remember us young folks who were helping and trying to make this happen, I cried. It was frustrating. And we were I was so desperate, I was ready to call the county myself and be like, you don't understand. I've not seen a single vaccine come into 95823, 95828, 95829. How do we get vaccines into South Sacramento? These folks can't go to Cal Expo. They can't even get an appointment. We can't go to Jesuit. When are you going to bring vaccines in? And it was just such an incredible effort. That night I cried, and then I did an analysis of who has power, who can we call? I called Councilmember Myvang, and I explained to her what was going on, and she immediately, that night, it was midnight, got a meeting with Sac County Public Health, went through, put her schedule aside and did everything she could to say, what is going on? Why do we have the highest rates of COVID, and we're weeks into this vaccine and there's been no vaccines in any of our neighborhoods? And that was the beginning of the SAVE Coalition, of getting Dr. Teta vaccines into her clinic and getting a multi-neighborhood, multicultural effort. And I'm proud because the Filipino community, we initiated that in a way, because I remember that night as I was crying, I was on the phone texting, our titas, and trying to ask, okay, give me your information, give me that. And my husband was on one computer, I was on another. I had Bobby and Dr. Ted on the phone. We were doing anything we could, to get folks connected. And I think part of this effort was a catalyst for where we are now. But what I also, when we talk about where we are now, I hope, and I think it really demonstrated to us how the systems are not built to address the needs in our community. And that is, I hope, a lesson that we learn in this time, is that not only do we, need to take care of ourselves, and we've been doing that for generations. We're good at that. But we also need to change the way the system works for us and demand that it works for us, so that foundationally we are cared for and we are seen. So when we need them, when we need help, or when things are happening to care for society, that we are seen, we are part of that, because we were not part of that initially. And so I guess I'm proud of our community, because I think we've learned that in this process. I think we're becoming more politically aware of why our voice is, why we need to be at those tables, why we need to elect representation that understands our experiences. I think that we are becoming we're becoming advocates, right? It's not just, the community center that we're trying to build. We're learning that we can't just raise money within our own community. We got to go outside and say, look, this is a service to the broader community and us. We hold up the healthcare system. We are essential workers. Our children go to schools here. We have advocates in the community. We are part of the fabric of this society. Invest in the Filipino community, and we demand it. We're not asking it. We demand it.
Yeah. I'll also say it's, being a part of it, being involved in it, being in the mix is so important. Not to just passively sit by and feel comfortable. Because what we saw, all of our lives were upended by this thing, beyond our control. But to get involved, to get in there, there's so much power in that, and we can harness that. And I believe that we won't get caught off guard again, because of what we've learned here, and and what we've done here and what we've built, the structures that we've built, the relationships that we've built. I believe that we won't get caught off guard again, and we can shape this to be, you know, a Sacramento that works for everyone, you know, and that we're all thriving, that there are no harm needs that are out there, and everybody has what they need, and that we're all good.
I think I can consider also that what you said, that we cannot work by ourselves within our community. Thank you, Megan, for reaching out. I remember you were calling our aunties and titas, wherein, hey, what's your address? And so just for them to get that vaccine. That's a great approach that we were able to get into our community. And also, Bobby, you said about partnering to someone else. I think what we have partnered with, aside from with our community, we partnered with people who can give us those benefits for our community, like our ARI. That's the best way that we have established this tier because of this COVID. Because without that COVID, we don't know ARI at this point. There's a lot of resources there, but we don't know what are those things. But because of this COVID, we were able to find a path for us to go there and check out what's at stake for us. Just like the grants that we have. ARI gave us a lot of grants. That's not because of ARI. I think we are at the losing end. We don't have that money to provide those education, those flyers, those vaccines. And of course, to mention API from Megan's network, thank you for those vaccines that you brought us, 180 vaccines. You remember that one?
Oh, the 100.
Can you talk about that one, what
Yeah.
you did for our community, Megan? Because that's very important to state at this point.
Well, I think too that the reason why, you know, our community, well, I shouldn't say the sole reason, but the reason why our community, we had bridges, right? Bobby, myself, like Vince, you know, writing grants and knowing what the resources are out there, you know, that's important. That's important across all cultures, right? Especially cultures that are misserved or misrepresented or underrepresented in Sacramento region. And I think that's, you know, when Bobby talks about, like, when we talk about equity, that's what equity is, right? The equity is leading with the people that are closest to the harm and the pain. It's, you know, we know that we're going to be okay. Like, as, you know, I have a job, Bobby has a job, we can work from home, those types of, like, I know as an individual, you know, but my concern is that there are folks that don't have the resources, access to the resources, or don't have the luxuries that we have. And those are the folks we should be leading with in these responses. These are the folks, these are the communities that, you know, should have priority. And that's so important, right? That's so important. I think that's what our community is learning, right? It's not just about us, it's about us, you know? And so proud of our community for really understanding that.
Right, I kind of like initiated this conversation by saying also that COVID has magnified a lot of the inequities, but it also has magnified a lot of our assets too, right? When you talk about the activation of leaders, right? The now access to different resources, the you know, the networks of relationships that we have built over the last couple of years, all of those have now become assets of our community that hopefully we can build on when the next crisis, the next kind of you know, challenge and need confronts our community, right? So, so I'm interested to hear, you know, how do you feel about the future?
Well, for the future for us, I think we already established the bottom line, the basement of what we're supposed to be working on to face another challenge in our lives here. But the next, but the challenge for us for the next few months or then in the next year is that how do we establish getting those vaccines or we have the second booster at this point. So at this point, how do we establish those things? That's because at this point, I don't have the vaccine yet for the second boost. But how do we help those seniors again to work out to those vaccines in order for them to fully be protected for this virus? And I know it's not yet totally eradicated at this point. It's still there. So, as a teacher, I can hear one of my students who was absent today, and I got infected by this COVID again, and blah blah blah. And the future at stake for me is that we were able to establish that relationship with other partners, and how do we continue working out or networking with them for the future? And how are we going to maximize that relationship in order for us to take advantage for our own community? I think that's something that we need to work it out at this point.
I mean,
Megan, how can you be a part, an essential part of this future of our? Because you are very essential. You are proactive to this one. So you are at the top of our game in terms of our community. So will we see a kind of politician next year or something? Okay, you
not
are
what
na.
the community.
No, because you're the voice. You're the future
Oh,
voice.
well, okay, let's be clear.
Okay, cool.
I will never stop fighting for my Filipino community. This is my
Thank you
family.
for that.
I was raised in this community, and so I have so much love for this community. But I also, so I lead the Asian American Liberation Network. Now, the Asian American Liberation Network, that name, because we were a coalition of Asian American and even Pacific Islander serving organizations at the time when we were founded. That name was founded in community because we asked ourselves, what are our wildest dreams, right? Like, what do our communities need when it comes to surviving, not only surviving, but thriving, right? And so liberation was a really kind of key component to that community process of founding this organization. And so when I think about the future, like, I'm always asking myself, like, what does it mean to be liberated? So I think a lot of the things that we talked about, what does it look like for our Filipino community to be liberated? We have representation, we have justice, we have access. And it doesn't mean there are not, it's not, we have all these things at the expense of other communities. It's that we have all these things like with our sibling communities, right? The Black community, the LGBTQ community, the Muslim community, the immigrant community, asylee, refugees, everyone who historically has been and currently is underserved and underrepresented. And that, to me, my hope is that we come out of this better and smarter, and we find ways to leverage our collective power as not just the Filipino community, but in coalition with all these other communities, to really demand again that that we deserve to live liberated. We deserve to live healthy, well, and all the other things that whatever liberation looks like. And I think too, clearly, tangibly speaking, staying at the forefront of access to vaccines and life-saving therapies. I think even, if we were to go even more, let's back that up a little bit more, making sure that our communities have access to health insurances or even universal health care, when you're born, you should be born with health care, regardless of your status and who you are. It's a humanitarian right, in my opinion. And I think I share that with a lot of Filipinos, right, in our community. We learned that it was crazy that our healthcare was connected to our job, because what happened during COVID, half of us lost our jobs, so then healthcare was gone, but we were getting sick. So just little things like that. How can we kind of be a part in those really foundational systemic changes that enable us to be liberated, right, as a community? That's what I want for the future, that we learn the lessons of the little things that we had to deal with, so that our next generation, we're cared for. We don't have to worry about those things.
So I know that a couple of organizations are working on making sure that our community is aware of Medi-Cal, right? For those who are underinsured or have no employment. So we'll make sure that that's mentioned in terms of our resources.
Let's talk about the community center too, right? That's another thing.
Go for it. Yeah.
Let's talk about how the community center is essential. We're not just talking about just a building, 4 walls, and then we get to go hang out there. This community center is a part of the secondary recovery response to COVID, right? It's a place where we can gather and talk about how we can advocate and build and organize. It's a place where we can make sure that it's a hub, right, for our community and sibling communities to get vaccinated or to get screenings and checkups, to stay well, to get mental health services. It's a place where we can be represented. It's a place of power, and power is so important, right? And I'm not talking about like power, like we're trying to wield power over other communities, but power to be seen and considered in the fabric of society. And so
having our own agency as a community.
Exactly.
Speaking of the community, center, where you said it's a powerful place for us to live, to have that in our community, to establish where we're supposed to be. Are. I think if we have that community center as an educator, I think we can establish that for us to educate and at least continue the traditional culture and heritage of our community. Because for us, we can teach them how to dance the tinikling there. Where do we teach tinikling at this point? We don't have any community. We don't have like this room here that we can come in and barge in and, hey, come in and we are to teach you how to cook adobo or lumpia or something or pancit. We need that community center at this point in order for us to establish and at least translate that tradition, that culture to our younger generation. At this point, my son doesn't know, he doesn't know how to speak Tagalog. He doesn't know how to say hello, opo, or ate, or something. But I want him to be, I want to include that culture in his system so that towards the next generation of our family, I want to see that someone who will be fully grown up here in the United States will be continuing that culture, that tradition, at least to say opo or kuya or ate to their siblings. So we need that community center for us to strengthen or to continue the tradition that we have at this point. I think that's the whole thing, that why we are working so hard for that community service. That's been a long time. Since when? 1920s, when FCSB was established here in Sacramento. Until now, we don't have that one. I think we need someone, as I said, a politician who could bring us that power for us to build that community center. Do you think that, Megan? What do you think, Megan?
I think that it's a community effort, but I'll fight for it for sure.
Thank you.
We'll all fight for it. We're gonna fight for it. We're gonna get it done.
Okay,
We're gonna get
good.
it done.
Thank you.
You make a good point, and I'll end with this: that our roots in the Philippines and our historical roots, our culture, our foundation is a part of the representation that we need to carry forward, because that's what power is, right? Representation is revolutionary, and if I'm not seen, if my community is not seen in the curriculum, if it's not seen on the streets, if I'm not, if my food isn't represented in the grocery stores and the restaurants, but we have, a huge population of Filipinos that live here, that's a problem.
Well, yeah, representation is
Representation-
literally about survival. right?
Exactly. And so I think that, I appreciate you talking about that, Marie, because we need to continue to be seen. And that starts with, having places where we can educate our young folks and keep our traditions and our culture alive and respected,
I actually want to amp that up a little bit, right? Because how many times have we heard you're to be seen but not heard, right? I believe what we need to get to is a place of belonging, right? Where we know we belong in the community, where we're not just included in the conversations, but our input and our contributions are actually valued and fully considered, and where everybody belongs, right? That's the next step up from equity. Equity must lead to belonging, and equity also must lead to this targeted universalism. Because what Megan may need for her liberation may be different than what I need for my liberation. But what we want for all of us is liberation and freedom. So that's the next step. And that's where I'm really most excited, that as we get more folks to understand what that's about, that we can get ever so closer to that, So I'm excited about that. I'm absolutely hopeful. I have God kids in the community that I want their futures to be just so much brighter, that they can share that, then they can be empowered and share that power with others and bring folks with them.
Okay, so, excuse me. We'll conclude by you sharing any piece of advice or any resources that you'd like to share with our audience.
Okay, with regards to that, as a Filipino community health worker, I think in order for us to establish this relationship and continue what we're doing, I think we need to pair up with someone else or to work with that partnership with someone who can help us. And I think we can, if we have someone who can be our voice somewhere else, not only within our community, but outside the wider scope of our community, like the Assembly or the Congress or the Senate, we need to choose that person for us to represent us. Someone who we believe in, for us to, for we can be represented in that particular level of discussion, who can help us in there. And I think we have someone else in mind that someone can help us through. So whoever is that, I don't know, the future is here. I don't know, Megan will be the first Filipino to be in the Congress or in the Assembly. We need that someone else. We need that voice in that particular level of discussion of who we are so that we can establish who we are. And if we just sit down here right now and without that help, I don't think we'll still be towards that level and we will not grow up and we cannot expand our wings and fly and soar out who we are in this community. I think we need to find someone else to help us as a voice for ourselves. Who knows? Vince might be the next congressman in the community here. Vince, how's that?
Okay. I think I'll
love
cede
that.
to Megan first.
Okay.
Go for it,
Okay.
Megan.
Well, let's
Any parting
first
words
all-
of advice and resources to share?
Yes, a couple things. Number one, I love that idea of representation from our community, but let's remember too that it can be any of us. You know, I notice in my community, and I do this too. I'm guilty of this. It's like, you can do it. No, you can do it. And none of us do it in the end. I mean, we've got like this many Filipino representatives in California, but our community is this big. So please, if you're in leadership, if you want to, you just like, we are building a pipeline. Sacramento Filipino PAC. We are, there is an education component to how we can achieve the Philam agenda and build representation, build a pipeline of incredible Filipino leaders, right? I'm down with that. Let's do that. Tangibly speaking, resources. The first thing I will say, and Bobby will probably echo this, is stay in touch with the updates as to how to get your vaccine. When's the right time to get your vaccine? Ask your caregiver, your PCP, your doctor. Where am I at in terms of when's my booster? Because that's critical. Get your booster. If you're not vaccinated yet, get your vaccine. It's imperative. It doesn't prevent infection, but it prevents death and serious illness, and that's important. The second thing I will say is, I had a meeting with California Department of Public Health a couple days ago, and I got to see their cool interactive tool where it shows our county and the precincts, the census tracts of where we are unvaccinated. And we're doing okay as a Sacramento County. We're about 70% of adults, but we are behind on our children. So I'm pleading with our communities and especially our Filipino community, if your child is eligible for a vaccine, please get them vaccinated. Both my children have been vaccinated since they were eligible. They are healthy, they are thriving. We vacation, we have a great time, they wear their masks, but they did contract COVID and they breezed through it, thank goodness, because they were vaccinated. So I encourage you to get your children vaccinated and stay apprised when we can vaccinate our under fives too. And then lastly, I will say that the Asian American Liberation Network, and I'll give this to Sean to plug it in digitally, but we have a COVID wraparound response program that we launched, and this is for our community members who, you have to, there's a criteria, an income criteria, but it will allow you to tap into some funding to pay bills if you were diagnosed and you were out of work, or if you had to quarantine and you have a hefty, hotel bill, motel bill. So please look into that. Give us a call. We'll see if you qualify and you can recover. You can help pay those bills from when you were out. But COVID is a financial hardship, and so we want to make sure that as a community we're tapping into any resources available through the county. So there's this. We can also get you connected to food boxes, food delivery services, mental health resources. Those things are out there. We just don't know it, and we need that bridge, as we talked about, to get us there. So please, call us and let us get you connected to those resources. There's also language assistance available if you need language assistance.
And we'll provide more information about that towards the end of this program. Bobby.
I will say continue to get tested, continue to mask up. I know that the mask mandates have gone away, but still encourage it. It's still a really good way to protect yourself. And the reason that I know this is because there are doctors that are treating patients with COVID all the time. And they're mostly not contracting COVID because they're wearing masks. So if you just even think about that, like we know that masks work. Vaccines are a great, option as well to add on to that. But in combination, you really can't go wrong. I'll also say, like, to Murray's point, like, get politically educated, join, and I don't mean just electoral. I'm not just talking about voting and electing people, but I mean, like, get politically educated on how you, as a community member, can affect all the things that are going on around us. SAC Field Pack is great. There's also the Fierce Coalition that's doing statewide efforts, and the Fierce Coalition is amazing. They've done policy summits the last 4 years and are really involved in trying to protect our community statewide. So yeah, learn about how to really build policy that benefits us all, and get politically educated.
Okay, Vin, one last thing. It's hard to not to mention about ACC Meals on Wheels because they're helping us with our seniors. Thank you so much. And are they our sponsors at this point? Thank you. Okay, we are in your facility, so it's hard not to say about this one. So thank you so much for providing all those seniors who are having smiles every Monday, picking up their 3 meals. And I heard that they're enjoying those meals every week.
Absolutely, thank you to ACC for including the Filipino community in their dishes program. And actually, we use also those Monday gatherings to provide COVID information around testing, vaccination. So yeah, thank you to ACC. And thank you to all of you for sharing your experiences and your thoughts and reflections around the pandemic, and as we emerge and recover, hopefully, from this pandemic, that I feel like we have so much more resources to bank on, right? To work off of the foundations that you all have built for our community is really incredible. So again, I appreciate you. Thank you for all your help. And for those of you who are watching this program, we will be including some resources towards the end of this program for some of those that were mentioned by our 3 panelists, Murray, Megan, and Bobby. And we look forward to seeing you, hopefully, on June 5th, Sunday, at Jose Rizal Community Center, because for the first time after a couple of years, we are doing an in-person celebration for Filipino Fiesta. Thank you.